Whiplash is a neck injury that happens when your head snaps forward and then back again suddenly and with great force. This motion resembles the cracking of a whip, which is why it's called whiplash. You'll often hear about it in connection with car accidents, especially rear-end collisions, but that's not the only way someone can end up with whiplash. It can also happen from sports incidents or any situation where the head is suddenly jerked backward and then forward. At its core, whiplash occurs when the soft tissues in the neck, including muscles, tendons, and ligaments, are stretched beyond their normal range of motion. This overstretching can cause small tears in the tissues, leading to inflammation, pain, and stiffness. In more severe cases, whiplash can also affect the vertebrae, discs, or nerves in the neck, potentially leading to more serious complications. Whiplash is surprisingly common, especially in our car-centric society. It's estimated that more than 3 million new cases of whiplash occur each year in the United States alone. Many of these are related to auto accidents, but a significant number also result from sports injuries, falls, or even amusement park rides. Causes of whiplash injury. As mentioned earlier, car accidents, particularly rear-end collisions, are the most common cause. When a vehicle is hit from behind, the impact forces the body forward while the head initially remains in place. This creates a sudden extension of the neck as the head moves backward relative to the body. Then, as the body rebounds, the head is thrown forward, causing flexion of the neck. This rapid back and forth movement is the essence of whiplash, but car accidents aren't the only cause. Sports-related incidents, especially in contact sports like football or hockey, can lead to whiplash. A tackle or body check can cause the same rapid head movement seen in car crashes. Similarly, falls, especially those where the head snaps back upon impact, can result in whiplash. Another cause of whiplash is a simple fall. You don't have to fall from a great height to sustain the injury. A bad slip on ice, or even a stumble while walking could cause your neck to move in a way that leads to whiplash. Surprisingly, even seemingly harmless activities can sometimes cause whiplash. Amusement park rides, particularly roller coasters with sudden starts and stops, have been known to cause mild cases of whiplash. In rare cases, vigorous dancing or headbanging at concerts can lead to whiplash-like symptoms. Lastly, physical assaults or any form of violent shaking of the head can result in whiplash. This includes being punched or struck in the head, or shaken vigorously. It's important to understand that the severity of whiplash doesn't always correlate with the perceived force of the incident. Even low-speed car collisions can cause significant whiplash injuries. Factors like the position of the head at the moment of impact, the individual's physical condition, and even gender can all influence the likelihood and severity of whiplash. Women are more susceptible due to typically having less neck muscle mass. Symptoms of whiplash injury. The symptoms of whiplash can be quite varied and may not appear immediately after the injury. In fact, it's not uncommon for symptoms to develop 24 to 48 hours after the incident. This delayed onset can sometimes lead people to underestimate the severity of their injury initially. Many people described the initial sensation as a feeling of disorientation, but as the adrenaline from the incident wears off, pain and stiffness typically set in. The most common symptom of whiplash is neck pain. The neck may feel tight and uncomfortable, with pain that worsens when trying to move the head. Some people describe the pain as a burning or aching sensation, while others experience sharp, stabbing pains with certain movements. The stiffness associated with whiplash can make everyday activities challenging. Simple tasks like checking blind spots while driving, looking down at a phone, or even lying down to sleep can become painful tasks. Many people with whiplash also experience headaches, particularly at the base of the skull. These headaches can be persistent and may worsen with neck movement. Some individuals report dizziness or a feeling of lightheadedness, which can be particularly troubling when trying to maintain balance or focus on tasks. Another common symptom is shoulder pain or pain between the shoulder blades. This pain can radiate down the arms, sometimes accompanied by tingling, numbness, or weakness in the arms or hands. These neurological symptoms suggest that the whiplash may have affected the nerves in the neck. Some people with whiplash report experiencing tinnitus, which is ringing in the ears or hearing disturbances. Vision problems, such as blurred vision or difficulty focusing, can also occur. These symptoms are thought to be related to the impact on the vestibular system, which controls balance and eye movements. Less commonly, some individuals may experience cognitive symptoms, such as difficulty concentrating, memory problems, or feelings of irritability or depression. While these symptoms might seem unrelated to a neck injury, they're believed to be associated with the overall trauma and stress of the injury. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of whiplash injury. Diagnosing whiplash isn't always straightforward because the injury doesn't show up on most traditional tests like x-rays. When you go to a doctor with neck pain after an injury, they'll usually start by asking about your symptoms and the circumstances of the injury. How fast were you going if you were in a car accident? Did you fall? How soon after the incident did you start feeling pain? Next, they'll perform a physical exam. This usually involves gently pressing on different areas of your neck and shoulders to check for tenderness and asking you to move your neck in different directions to see how limited your range of motion is. They might also test your reflexes, strength, and sensation in your arms and hands to check for nerve damage. If the doctor suspects that the injury might be more serious, such as a bone fracture or damage to the discs or nerves, they may order imaging tests. X-rays can rule out fractures, but they won't show soft tissue injuries. For that, the doctor might order an MRI or a CT scan. These scans give a more detailed view of the muscles, ligaments, and discs, which can help in diagnosing more severe cases of whiplash. Treatment for whiplash injury. The treatment for whiplash largely depends on the severity of the injury. For milder cases, rest and self-care are often enough to help the body heal. One of the most important things to understand is that while rest is crucial, staying immobilized for too long can actually do more harm than good. Gentle movement is key to keeping the muscles and ligaments flexible. In the initial stages after the injury, applying ice to the neck can help reduce inflammation and pain. This is usually recommended for the first 24 to 48 hours. After that, heat therapy can be useful to relax the muscles and improve blood flow to the area, which promotes healing. Over-the-counter pain medications like ibuprofen or acetaminophen can be helpful in managing pain and inflammation. If the pain is more severe, a doctor might prescribe stronger medications or muscle relaxants to help ease the muscle spasms that sometimes accompany whiplash. Physical therapy is often a cornerstone of treatment for whiplash. A physical therapist will guide you through exercises designed to improve flexibility, strengthen the muscles, and restore the range of motion in your neck. The goal is to help you regain full function and prevent chronic pain from developing. In some cases, your doctor might recommend wearing a soft cervical collar for short periods. This provides support and limits movement, but it's important not to rely on it for too long, as prolonged use can weaken the muscles. For more severe cases of whiplash, especially those involving nerve damage or disc injuries, more aggressive treatments may be necessary. This could include injections to reduce inflammation or even surgery in rare cases where the injury is affecting the spine's structure or nerves. Many people recover from whiplash within a few weeks or months, but for others, symptoms can linger and become chronic. This is known as whiplash-associated disorder and can be more challenging to treat. Chronic whiplash symptoms might include ongoing neck pain, headaches, and difficulty concentrating. In these cases, additional therapies like chiropractic care, acupuncture, or counseling to address the emotional impact of chronic pain may be recommended. Now, we want to hear from you. Have you ever experienced whiplash or know someone who has? How did it impact daily life and recovery? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.